everyone. My name is Atiya Jaharashidi. When I'm busy trying to get things done, I kind of forget that part. I am the Chief Equity Officer and Vice President of Community Relations, and it's because of our visionary, which I'll bring up next, that we're able to have Men's Health Night here on an annual basis. And I do want to acknowledge some people in the room at this time as well, and that is our board members, Rick Dixon, and board member Philip Gilmore, Pastor Gilmore. And our South Ward Councilman, Pastor Council. Okay. And now at this time, I really want to call attention to today's date and really acknowledge and have us have a moment of silence, because again, 9/11 is today's date. This is an earlier date than we usually have Men's Health Day, but we want to acknowledge that space as well. And so before we begin, I would like to take a moment of silence in observance of the 22nd anniversary of the September 11th terror attack. Thank you. Now, it is my absolute pleasure to introduce our President and CEO, Mr. Darrell King Terry Sr.
Yeah.
It is because of Mr. Terry that we are able to host this event on an annual basis to make sure that we prioritize men's health. And so without further ado, Mr. Darrell King Terry.
Give me my theme music. Good evening, everyone, and welcome to Newark Beth Israel Medical Center and Children's Hospital event, Men's Health event. So, Ray Murphy Men's Health Night. Ray Murphy was a good friend of mine. He was an employee, longtime employee of Newark Beth Israel Medical Center. He was an advocate for patients, for men, for women, for anyone who needed anything. Ray was a spectacular guy, and we honor his memory by having this event every year. And so I want to thank each and every one of you guys for coming out and being interested and involved and engaged in your health. Last year when we had this event, I was overwhelmed by the kinds of questions, the honesty, the trust that this group had with our physicians. People asked some really tough, personal type questions. And that's the only way that we're going to get better, is if we, take down the mask and dig into how we can better take care of ourselves. So I have a couple of people that I need to acknowledge before I turn the mic over to our moderator. So Atiya Jaharashidi is outstanding. She led this, she put this all together for us. All the volunteers, all the people that you see in that room have volunteered their time because they are interested in the health and well-being of our community. And so, they're in there still taking screenings and giving health education and awareness, but, we want to acknowledge them for giving us their time. The next group of people that I want to acknowledge is this table right here, our esteemed physicians. Each year they come out and they give what they have to our community, not looking for anything back, not looking, everybody thinks that everybody's looking for something. They're just interested in a healthier community. And I want to applaud our physicians from Newark Beth Israel. Thank you. So now's the time where I ask all Cowboy fans to get out. You're not welcome here. We really care about your health. You guys need mental health. That's what's so without further ado, I'd like to bring forth someone who I've gotten to know over the years. He's been with us for many years now. George Martin, Super Bowl champion George Martin, Super Bowl I'm glad we didn't have this event yesterday. It probably would have been a little tough for George. But he is a gentleman, and he is very interested in this event. He looks forward to it, and certainly gives us his all every year. Thank you, George.
Thank you very much, Mr. Terry. And they say imitation is the most sincerest form of flattery, and I will return the favor. But first of all, I'd like to say it is not just an honor for me to be here. I look across the room now, and we're almost maxed out. Man, it's absolutely, it just does my heart good to see all the brothers and all the people who are concerned about their health coming here tonight for what is, for me, probably the 15th annual event. And it is something that is a life-saving, life-altering event. And to see you guys come out yet again, and under such extraordinary circumstances with the weather, it does my heart good. But before that, I have to acknowledge the elephant in the room, as it were, because none of this would ever transpire. As much as it's needed and as well as it's anticipated, it would never transpire without the vision of one individual. An individual who has distinguished himself as a true leader in the community, particularly in the field of health. And what really inspires me, and it wasn't even mentioned, is the new facilities at Newark, Beth, Israel. Have you guys seen that yet? Yeah. That is the genesis of a lot of individuals, but it is the brain trust of one individual who had a vision, and that vision has come to fruition. So I'm going to ask you guys, which may be part of your initial physical fitness, to stand up and give this individual a welcome round of applause. Mr. Darren Terry. Yeah. Well deserved. And although I'm not a mathematician, I can tell you this. If you were to calculate over the 15 or 20 years that we've done this, how many lives have been impacted, how many people have been saved, how many people have been touched, how many fathers have been, been saved, how many young sons have been, whose life has been altered, how many people have been touched throughout the generosity and the absolute contribution that this institution has made, it would be incalculable. It really would. I had the privilege of sitting at the table there talking to some of the brothers earlier. And it's almost like dropping a stone in a lake or in a body of water, and it begins to ripple. You've seen that? The ripples from that table, that's across this gentleman. The ripples from that table across this gentleman. And it continues to ripple, and it permeates the society. That warms my heart to see how many people's lives have been touched, have been impacted, because somebody dared to go beyond what was expected and address what was vitally needed. I have lived throughout the entire United States. I currently live in Sacramento, California, capital of California. And I can tell you, I've lived all in between, and I've never seen an event, I've never seen an organization, I've never seen an instrument like this anywhere else but right here. That is unique. That's all. And Mr. Terry was right. No man is an island. And he has a wonderful staff that I have worked with for many, many years, and they are accommodating, and they have one thing in mind. And one thing is your well-being, your benefit. Tia is the young lady who spearheaded this, and believe me, she left no stone unturned. She puts in the hours, she puts in the commitment. So if you guys get a chance, and I mean this, before the night's over, that young lady and that ungodly Steeler. Go up to her, shake her hand, and just tell her how much you appreciate it, because she has really worked endlessly to make this happen. So, absolutely. The other thing I'd like to bring up before we get started with the program is that for those of you who are NFL fans, there is an inordinate price that we as players pay in order to bring that entertainment week in and week out on the NFL season. And one of the things that you guys have heard about that's very commonplace these days is CTE, chronic traumatic encephalopathy. It's just one of the many medical scourges that impact people like myself. Okay? And the reason I bring that up is because, unfortunately, I've lost a significant amount of colleagues over the years because of the dangers associated with professional sports. But that is only to highlight the importance of taking care of yourselves, medical awareness, and doing what you guys are doing tonight across the entire spectrum. That's how important it is. It is life or death. And I have grown weary. I've grown very weary of attending funerals, some of my former teammates, that I consider to have been premature. They could have been prevented. I guarantee you they could have been prevented. But when people ignore the warning signs, when people think that there's time, when people think that, it's not that important, when people think that, I'll just live with it, when people think that, I don't want to hear about them nagging me about this or that, it's time for us, and by the way, which is evident of all you guys coming, this room is full to capacity for the first time. It's evident that you guys are hearing those warnings and taking them seriously. And the gentleman here in the blue shirt, he was talking about how he has talked to his friends ad nauseum about the importance of our health, our unique need for medical awareness all the time. And that's why I want to salute you people who came here tonight. That is phenomenal. It warms my heart. And I know Mr. Terry has already said this is probably one of the most successful events that we've had thus far regarding the men's health. So a salute to all of you. Thank you guys for coming. And now, without further ado, we're going to have a very important panel that has been constructed for your benefit. And this is one of the things that's so important because, we can't address everything because we don't know what might be on your mind, might be your concern. And this is why this panel that I'm going to introduce that'll be coming here, I'm going to address your specific concerns, your needs, answer the questions that you have. And I remember last year, we had such an engagement. It really went very well. So hopefully we'll be able to replicate that again tonight. So our starting panelist is Dr. Montgomery. He is a cardiologist with advanced heart failure treatment and transplant team at Newark, Beth Israel Medical Center. So Dr. Montgomery, would you please come up, sir? Secondly, we have Dr. Chan. Dr. Chan is a urologist with the Essex Hudson Urology Group, and he takes a holistic approach to urology care, ensuring that his patients understand and share the decision-making process, which is very important. Dr. Chan. Next in our illustrious lineup, we have Dr. Savatta. Dr. Savatta is also a urologist who focuses on treating enlarged prostate. You should probably hear from my benefit, I'm sure. Prostate cancer and other urological cancers through robotic surgeries. So, Dr. Savatta. Next we have Dr. Mohanty, who is a gastroenterologist and is director of the GI program at Newark Beth Israel Medical Center as well. Nextly, We have George Bustillo, who is board certified in internal medicine, and he has been seeing patients at Newark Beth Israel Adult Health Center since 2014 and is very active in the community, both at home and abroad. Thank you very much, sir. Nextly, we have Dr. Bergman. He was born at Beth, as a matter of fact. Dr. Russell Bergman is Vice Chairman of the Residency Program, Director of Dental Residency Program at Newark Beth Israel. He has been a clinician and educator for over 25 years. Lastly, and I apologize if I mess up the name, Dr. Oczkos. Dr. Oczkos is a psychiatrist who is proud to be working with Newark Beth Israel Medical Center, and he grew up in the area and enjoys walking to work every day. That he has my admiration. Doc? So, as we begin, the first question. One sentence. If you, the panel, if you could only give a word or give a sentence of advice to the men in this room today, what would you tell them? What would be the advice that you would give them? And we'll start with you, Doc.
So this question came up to me right when I came in, so I can promise I didn't rehearse it, but it comes from my gut. A lot of us, we grew up looking up to our parents, trying to be like our fathers, trying to be as good as them, but we need to remember that they wanted the best for us. They wanted us to be better than them. So don't hold back, reach out, and don't be the tough guy. But if you need help with mental health, do the right thing and get that help, okay?
Thank you very much.
Oral health is part of overall health. And it's important, let's talk about quality of life. And it's true about good oral health. Quality of life, you obviously want to avoid pain. Obviously, you care about aesthetics, the way that you look. It's all about oral health. And lastly, I'm looking forward to after this eating as well. And it's all about function. So those things, if you lose any of those things, you'll understand truly why it's part of a great quality of life.
Thank you very much. Yes, sir.
One word, prevention. And I think you guys are taking the first step here, just by a show of hands, how many of you have a physician? It's the majority of you. How many of you have seen a physician this year? So that's good too. So, I think prevention starts with you guys, so taking the first step, by showing up to see your physician and working together, to allow you to educate you, and empower you with some education, in terms of what the preventative care, will be. So, and we can talk more about some of those things, screening you for prostate cancer, screening you for colorectal cancer, screening you for lung cancer, and the list goes on, but that's part of you taking the first step, and that's what you guys are doing, so prevention.
Thank you very much.
To the same token, I go back to oral health followed by prevention. Particularly in gastrointestinal health, colon cancer screening is very important. I am seeing in the community sometimes 60 coming in. In addition, alcoholic liver disease also tied with that, affecting almost every member of the community. So I think one of the things is moderation of alcohol, and so colon cancer screening is very important.
Thank you very much. Yes, sir.
Two points. Sorry, George. But one is really education, right? And I think the reason why you lost a lot of your colleagues and we lose men too early, is because we don't really understand our bodies and what's going to happen. And we're scared. And if we knew what was going on, it would be different. If you cut me open, cancer spread everywhere. No, that's because they had CAT scans a long time ago. When we found all the cancer we opened you up, it was already there. So there's so much things that we didn't know and that we know now. Prostate cancer is one of my passions, and cancer in general, with a lot of personal family history. But with prostate cancer, I did a surgery this morning on a gentleman, a big guy, bad cancer, home 2 hours after surgery from Beth Israel. He's at home now, probably not even taking narcotics. we do this now because of technology and understanding state-of-the-art, technology and how to make outcomes better. So if you understand what can happen on the worst part, and that's not so bad, 4 hours in the hospital, or 8 hours in the hospital, then also, it's a renaissance now of medicine that's happening with this AI and all that stuff. So don't be scared of it. Try to understand it. Trust people. And then one of my good friends is out in the audience, Kev. Years ago, he was at a boxing match with one of his close friends together that we had. And I was like, you got to come into the office. You got to get an exam. I wanted an exam. So you have to listen to the patient. Now I said last year, I said in the future you won't need an exam. So I think my opinion, and it's been studied in some other studies, and I want to hopefully study it in our community. We can get by without doing a prostate exam anymore. We can get a prostate MRI instead of a prostate exam. And I want to push now, if you guys don't want to come in and get examined, we used to force them to come in because we had to. But if we have a better way of doing it, let's use technology. All right. So get yourself educated and know what your body's like, and then you'll get the prevention you need.
So I think one of the most important things is realizing that you can be your own greatest advocate, and part of that is education, like Dr. Savata said, but also seeking out, what you need to do to help prevent things that are preventable, but also realizing that you have the power to do all things for yourself as well. And a lot of, men's health is related to overall health. So taking care of your heart, taking care of diabetes, etc. All those important things are important for men's functioning as well.
Thank you.
So for me, I just add two things. First is kind of echo what a lot was already said as far as being your own advocate, and really what I would say is just know your numbers. Cardiology is filled with a lot of numbers and a lot of tests and things like that, as most medical specialties are, but knowing what your blood pressure should be, what your cholesterol should be, what your other laboratory values should be, so therefore you can become your own advocate when you're going to your doctor, and you can ask kind of educated questions to kind of become more of a partner with them, instead of it being us saying that you should do this particular thing, you saying yes or no. So I think a more partnership with your physician can be created by you being your own advocate, and also knowing your own numbers.
Well, thank you all for that input. Now, guys, realize that these individuals have come here. They've invested their own time specifically for you. Okay. So now it's your turn. We have, as I understand, we have the mics here. Is that correct? We have the mic here. We don't have a mic here, so I know last year we had a formulated a little line. So I'm going to stand over here for people on this side who might have questions. The panelists is here for your benefit. So for those of you who have questions, please formulate a line, and they will answer your question. They will address your question. Either way.
Good evening, gentlemen. I work at the gym 2 to 3 times a week. Normally, my heart rate is between 69 and 71. But when I'm working out, sometimes it goes up to 140. Now, is that normal or what?
Okay, so the way in my, how old are you, sir?
72.
72. The reason I ask that is because as you're working out, the goal of working out and the goal of actually, kind of getting into physical fitness is to get your heart rate up, to, really exercise your muscles and really increase. And as you do work out, your heart rate is going to increase, your blood pressure is going to increase. That's part of the natural physiology of your body. When your heart pumping more blood and oxygenated blood to the body and to the muscles. But your heart rate should only go up to a certain point, and there are different equations that we look for to kind of see how high your heart rate should be. And without getting into too much specifics, we kind of just say, if you have a 220, it's minus your age, your heart rate should be about 80 to 85% of that number. And so if you find on a regular basis, as you're working out, your heart rate is going into a number that is higher than that, or if you have associated symptoms such as headedness, dizziness, overall fatigue or chest pain, these could be signs that, you know, you might have some kind of pathological issue that might be causing the heart rate to go faster, such as arrhythmia. And arrhythmias can be very, very abnormal heart rates that can go fast or very slow.
This question regarding organ transplantation. Can you explain to brothers here the value and importance of good quality health prior to transplant and how it affects your recovery?
Anyone want to take that?
So first, you know, I just want to say Charles is a great guy. I'm glad to see him here along with everybody else here. So, you know, the question was regarding good health and good health prior to transplant. Obviously, the goal is that we will not have to get to actually needing a transplant. But we should all know, again, when you talk about knowledge is power and being aware of what your options are, so you can ask, you know, intelligent questions with your physicians, knowing that if you do get into a point where you are severely sick, transplant is an option. And I think that that is one of the options that, you know, is considered an advanced therapy and oftentimes may not be offered in with as much regularity in certain patient populations. But this is something that definitely is an option for us. And so when you are looking at overall health, if you do have a certain organ system, or say, for instance, if you need a heart transplant, the goal is going to be trying to maintain and do what you can do to ensure that your other organs stay in good health. And that's really just doing what you can do, such as all the regular things that mom and dad told us when we were young, eating correctly, you know, eating your vegetables, trying to work out, trying to, you know, decrease salt intake, decrease fat intake, and really just trying to live an overall healthy diet and live an overall healthy life with exercise. And so that overall can lead to an overall good health despite having decreased function in one organ system.
Doug, what is the process? I had a friend who just recently underwent a heart transplant. Is there a medical regimen, an intense regimen of visits to the doctor and pills and transfusions and all that, or does it depend on the patient?
So it depends really on the organ system. So specifically speaking with the heart transplant, all transplant is considered to be a very invasive procedure and is considered to be what's called an advanced level of care. And so after leading up to transplant, there are multiple doctor's visits, not just with your physician for that specific organ system. So I'm a transplant cardiologist, and we would have, you know, visits with our patients specifically on that. But as they're going through the process of getting worked up to be evaluated for transplant, they may have to see a gastroenterologist doctor, and they have to see their internal medicine doctor or urologist. All of these physicians here on the panel are involved in the overall workup for any patient that's being considered for a transplant. So it's what I like to call a 360-degree evaluation, looking at every aspect, including mental health, before we go forward with some type of evaluation for that.
Thank you very much, Doc. Next question here.
So first, let me thank Mr. Cherry. Let me thank Atia, Mr. Martin, the physicians that's all here. A lot of our problems seem to be what we consuming, and our food supply in this country seems to be crazy. How do we keep up with good gut health? I'm always concerned about gut health. And you can drink as much kombucha as you want to drink, etc. But how do we keep up with good gut health? Because I think a lot of our food supply is just crazy, and we just need to make sure we know what we're doing with that. Thank you.
That is a very good question. In general sense, if you go back from the history, when we were eating whatever we had, but also were active, that's making no difference what we eat. But things have changed as we industrialized and also learn more about our health. We realize that the different component of the diet has to be appropriate. So, for example, your diet should be 40% of carbohydrate, and then 35 to 40% of protein and other things comes about that. So it's all total, we're looking at 100%. So fat certainly contribute 20 to 20%. So with this scenario, we have to have appropriate distribution of the food product. So if I'm sorry. So with this scenario, we need to have a certain amount of not only nutrient, also fiber. So appropriate diet includes not only protein, carbohydrate, vitamins, and minerals, also fiber supplements. So that will give you overall component of the food product, so that bowel feels somewhat full, so that you have appropriate activity of the gut microbiota. So that way you have appropriate absorption, appropriate excretion, at the same time you have enough diet. At the same time, moderation very important. So there is an appropriate calorie requirement with somebody has sedentary activity versus heavy activity. For example, somebody doing heavy exercise, their calorie requirement is different from somebody sedentary activity. So average calorie requirement, somebody has sedentary activity 2,500 approximately 2,000, something like that. So you have the appropriate distribution.
Can I add something to that actually in terms of diet? Has anyone in here ever had a kidney stone? Yeah. Okay. So I think what a lot of people don't realize is that kidney stones are very much related to diet as well. So just some things to watch out for is making sure you're drinking enough water. So fluid intake is very important. People always ask me, like, what's a good thing to drink? Really, the best thing is just water. I understand coffee because I also drink coffee, but mostly water is pretty much the only thing you really need. Sodas are terrible, juices are terrible. Some other things that can help also are good for your heart, actually also are limiting your salt intake. So this is either food that you're cooking at home, food that you're maybe eating out at restaurants, or you're eating a lot of prepared foods, snacks like potato chips, those types of things have a very high sodium content. And the way that your kidneys process the sodium that you're eating can also increase your risk for kidney stones. So trying to lower your sodium consumption is very important, not just for kidney stones, but overall health, honestly. A third thing is to make sure that you're balancing how much animal protein you're eating. So meats like beef, chicken, pork, liver, and increasing your intake of fruits and vegetables will also help as well. But a lot of these things seem like they're kind of silly, but it's stuff that you can do that are healthy, but also preventing a lot of issues that can come up later on in the future.
Can I just add one thing in terms of the diet? We call it the plate method, and I think we can all envision our plate in front of us. If you divide it in fourth, so a fourth should be your protein, which is what some of my colleagues were talking about, the chicken, the fish, or meat. Your other fourth should be your carbohydrates, your starches. So we're talking about the sweet potatoes, mashed potatoes, rice or bread. The other fourth should be your vegetables, and the other fourth should be your fruit. So if you kind of keep that in the back of your head, because sometimes our plates can be very heavy with the starches, and then on top of that we put the meats and all of this stuff, so think about the plate method when you're eating.
Very, very quickly, guys, is there a reference guide? Is there something you can point to the people so if you go to it and get a quick reference guide as to how to approach this dietary balance?
I think I saw some information, at one of the tables, and I think they do have something about the plate method there. So I'll definitely look to see if they have it, but if not, we can definitely send some information.
Okay, great. Yes, sir.
My cholesterol runs a little higher than normal, not a little higher than normal. And my doctor had put me on atorvastatin and generic for Lipitor. But I'm concerned about that. I tried changing my diet, and it had little to no impact on my levels. And so I'm concerned about that because now he's speaking about increasing it to maybe 40 milligrams from the 20 milligrams, and I'm concerned about the impact that would have on my liver. So can you give me any advice in that regard?
Also for the panel, if I can, please just remind you as you speak, please have the mic close to your mouth because we're not getting proper acoustics in the back so everyone can hear their answer, response, please. Thank you.
So that's a very good question, and that is something that we always pay attention to. So my rule of thumb, whenever I have a patient, whenever I have anybody that comes in with any form of high cholesterol, first there's multiple components of your cholesterol. So there's your total cholesterol that you pay attention to. You want that number typically to be below 200. Okay, then you have your You have your LDL cholesterol, which is what I like to call the bad cholesterol. You typically want that number to be below 100. However, if you have diabetes, it should be a little bit lower, almost below 70. And then you have your HDL cholesterol, which is the good cholesterol, and you want that oftentimes to be above 40. So when you talk about cholesterol with your physician, you want to make sure that you ask the question about what each individual level is. And then you have your triglycerides, which are more a function of what it is that you're intaking, what your diet that you have. Now, when you talk about atorvastatin, that's a very common medication that's prescribed. It actually works fairly well, but it can have side effects just like any other medication we have. And adverse effects on the liver is one of the side effects that it can have. What we do is we oftentimes check regular routine blood work. Once you're on the medication, every 3 to 6 months is about average to kind of check that to make sure that there haven't been any type of increased levels of your, as far as your liver function is concerned. But if the liver function is maintaining, it's a fairly well-tolerated medicine otherwise. And so going up, if you need to go up on the medication and it's not affecting any liver function, I would say that if you need the treatment, it's the benefit outweighs the risk.
Can I just add a little bit? I absolutely agree with you. I absolutely agree with you. One of the things that people always think that taking Lipitor have adverse effect to the liver, actually very, very limited, even higher dose. So I have done even biopsy. Somebody has liver function gone up, and I've done biopsy. There's very minimal damage to the liver. And there have been multiple studies been done. Lipitor has more benefit than side effects. So I just absolutely agree with you. So oversensitiveness, as we realize liver function goes up, that's not really always the case.
Question over here.
Yes, I had my brother-in-law a couple of, about 2 years ago, had a massive heart attack. He was rushed to, well, he went to one hospital, and they took him to Hackensack Hospital, and they did an excellent job of helping him back and getting, his heart regulated. But the thing was, he couldn't have a heart transplant because of his age, and I wasn't aware that there was, that's one thing that they were considering. I guess if you're a certain age, you're not allowed to have, they won't necessarily give you a heart transplant. Or is there an age limit?
So I wouldn't think of it as an age limit. I think the best way to think about it is what's the best thing to do for the patient, and what is the best thing to do where you're going to have we're going to have more good days after you get a transplant than good days leading up to transplant. And what we do know from prior studies is that anybody over the age of 70, mostly over the age of 75, do worse after transplant than the ones under that particular age.
So, Doc, is there a state regulation, or is that from hospital to hospital that you make that decision?
Right, so it's not a state regulation. It's more so a consensus amongst the medical and transplant community that looks back at this data, and we can look at transplant trends from, back 15 to 20 years. There's about 32 or 3,300 heart transplants done in this country every year. And so when you look at the conglomerate of all of that data over the past, I think the first heart transplant was done in 1967, and that was done in South Africa. But since then, over the last 50 or 60 years or so, they've had these increasing numbers. So there's a pretty large volume of data that we have, and we can look back at all of that data, and we can see who does better, who does worse, what other risk factors would make people succeed or not succeed after they get this very invasive form of therapy. And our goal is really just to make sure that whatever we do, and just like anybody here on the panel, whatever we do or whatever we suggest for any of our patients, that you're going to benefit from it. And not just that it's going to be a particular form of therapy, that after the form of therapy, you don't have a higher likelihood of doing better than prior to the therapy. So I admit it is a gray area, but it is something that is based in slant data. So what the follow-up question was that has to do more so with the shape that you're in leading up to either needing a transplant, leading up to any type of medical intervention, which is 100% true. And so, what we like to say is, what is a patient, or what is someone's stated age, their chronological age, or what is their age more so with the type of lifestyle that they've led. And so we have, all of us have seen patients, I'm sure, that, maybe are 70 or 72, however, they have very, very mobile, and they're, not really having a lot of the other elements that, someone typically that we would think in their mid to late 70s may have. This may be somebody that might be considered for, a transplant or some other form of advanced medical therapy versus someone that has a lot of other, what we call medical conditions that may be in their 50s. So it's not a foregone conclusion that age basically says yes or no with regard to this therapy. It's a very comprehensive and complex decision.
Thank you. Question, please.
Good evening, gentlemen. So going back to the liver, I have two questions. What exactly is fatty liver? What does that mean? That's one. Two, if ED has to do with age, right? And as you get up in age, why are ED meds so expensive? Like sildenafil, Viagra, why are they $25 a pill or $20 a pill? Men want to be able to use their penises, and I think that's highly problematic. And so what can we do about that? And so in terms of the fatty liver, I know you can't get the fat out of your liver, but how do you decrease that, and what is that whole ideology about?
I don't know, I think the erection question is really the important one to me, so if you don't mind. So, tadalafil, I get mine for Costco, 5 milligrams once a day, 90 tablets for like 20, 22 bucks, and if your wife picks it up, for some reason it tastes even better. But all kidding aside, that's true, she picked it up for me. But no, here's an opportunity to talk about, the short answer is the system's kind of broken. Right? And the good news about the sildenafil, the tadalafil, is they're generic now. So when something becomes generic, one good thing is that most of them you can get very inexpensive through coupons, Costco with the membership. So like a sildenafil should only be literally 50 cents a pill, or less. So one thing as a prostate cancer specialist, we do a lot of these medicines for rehabilitation after surgery. Guys are getting radiation, and we know that it helps them recover sooner. So to me, I personally, honestly, I'm taking it because once you're a little bit off, it gives you better than when you were before. But my personal belief, I don't know if this has been studied yet, I know it hasn't, but I think it may give me more longevity as well. So there are options, and one thing I always try to do with my patients is, I can prescribe something, but if you can't buy it, you're not going to take it. So compliance is a huge issue here, and that's a bigger question than I can answer. But usually things are generic, and the system hasn't been totally corrupted on those medications. And fortunately, sildenafil and tadalafil are super inexpensive. You can get them very inexpensive through coupons and other ways. Most doctors should know that, or it's pretty easy to find it online. Sorry, the liver is also somewhat important.
It's okay. No, I think the ED is as good as fatty liver, but one is diet dependent, another one is medication dependent. So what is fatty liver? And this is a very important topic at this point in the time, because as the country or state getting industrialized, people are getting industrialized, they are not active that enough. So by simple definition, fatty liver means fat get deposited in the liver, and liver cells get enlarged and causing swollen liver. Then long term, this fat deposition causes inflammation or injury to the liver. That's the simple definition of fatty liver. So why that is important? Everybody talking about when you get ultrasound, and then suddenly there's any kind of fatty liver. So the very, very important aspect is that over time, 10 to 15 years, the fat causing more and more injury to the liver, and you develop scar tissue. What we're going back towards development of different stages to develop cirrhosis. similar to what we're talking about, alcoholic liver disease causing cirrhosis. You cannot differentiate fat causing liver disease versus alcohol causing liver disease. They'll look bigger and get scar tissue and nodular. So they both are interlinked. First of all, there are several risk factors: diabetes, obesity, and high cholesterol. At the same time, if you're drinking alcohol, top of it is similar. So they also cause further progression of liver disease. So in other words, 10 to 15% of patients over 20 to 30 years develop significant liver disease leading to cirrhosis and liver failure. Why that was important. The second question is how we prevent it. Currently, the biggest data to prevent is, number one is diet, second is exercise. And the simple walking is not good enough. The goal is to moderate exercise, particularly 40 to 45 minutes per day, 3 to 4 sessions, and also portion control the diet, so that if you lose 7 to 10% of body weight in a year, your fatty liver significantly improves. The biggest data is bariatric surgery. As you know, fatty liver clearly improved, but that's extreme. But everybody don't need to do bariatric surgery. So most important aspect again, diet, portion control as he mentioned, and also exercise, which is 3 to 4 times a week, at least 45 moderation of exercise. Hopefully that answer, I can answer more, but I don't want to take up more time.
Can I just add something to that? And I think you mentioned, that you have to, other contributing factors are your diabetes, your high cholesterol, so some of those things need to be controlled as well. So things to discuss with your physician, taking your medications, knowing your numbers. So in those situations, you definitely want to continue taking the statin, as one of the gentlemen was talking, and then your diabetes medications as well. So.
Did you have an addendum?
Yeah, a quick addendum. Just because I feel like there's probably going to be a couple of ED questions as well. But about 50% of men over the age of 50 have some degree of ED. This could range from not staying as hard as you used to not getting anything at all. So it's very common. It's nothing to be ashamed of. It's something you should talk to your doctor about. The second thing is that besides medications, there's other things that you can do that can help treat it. There isn't some magic cure that will return you back to where you were when you were like 20, 25, but the important thing is to maintain what function you have now. And a lot of that comes down to overall health. So diet, exercise, keeping your blood pressure, your diabetes, your cholesterol under control, all of these are important for maintaining what health and function you currently have. I always tell people that there's 3 things that you need in order to have a good erection. One is you need good blood flow. This has to do with cholesterol. If you have any issues with peripheral vascular disease, treating those. 2 is you need good nerves, because basically the brain is the largest sex organ that you have. And it basically needs to send signals down to the penis in order to get a good erection. If your nerves don't work because of diabetes, if you've had radiation, if you've had chemo, whatever, then you'll have some effect on your erection health. The third thing that's important is mental health. So there's basically 2 sides of your brain. One side tells you to, survive. One side tells you to relax and enjoy life, basically. If there's anything in terms of anxiety or trauma or self-doubt, like you've had an episode of ED in the past, and this time you're scared that it's going to happen again, that part of your brain, which is the survival mode, basically shuts down the other side of your brain, and you're not going to get a good erection. So part of it is, medical, in the sense that you need to have good, working blood vessels and nerves, but the other part does come from your brain, and that is very important, and I think something that is underestimated in terms of sexual function.
Thanks, Doc. As a courtesy, guys, to the tables around here, could you please lower the volume or silence your phone, please? Thank you. Yes, sir.
Yes, good evening. I know that men are less likely to go to the doctor than women. And I read that black men are even less likely to go to the doctor than other men. My question is, there's some doctor's visits that are a bit more invasive than others. No one is really interested in going to the dentist or the urologist or even get some type of gastroenterology invasive scope. Is there anything that's being done to make that process less fearsome or less invasive?
Give my colleague. Yeah, next one.
One thing I mentioned before is that for me, I've been doing prostate cancer for a long time, and my first focus was on making the surgeries as good as possible. We did pretty good with that. Then we made the biopsy a way to basically get tissue out of somebody without hurting anybody, so we don't go through the dirty area anymore. We go through the rectum, we go through the skin, so we get rid of that. So my another thing is we understand how technology works. By the time somebody thinks about it and studies it, and there's papers on it until it actually comes in clinical practice, then insurance is approved. It's probably 15, 20 years. So you don't really have the time for that. So one of my, kind of my passions is I want to try to say we have technology. I have an engineering background. What can we really do to use the technology and use it wisely? Because if we do more preventative medicine on the front end, for example, a prostate MRI costs under $1,000 now, and we can get a lot more information out of one prostate MRI 40, 45, 50 years old. That's when we get mammograms, and without any radiation, we can get a good prostate cancer risk without even having to put a finger in the bottom. So my guys that are getting prostate MRIs or want them, we don't need to put a finger in the bottom anymore. And as a urologist, you probably say I'm crazy because he's trained that you have to do that. I learned that the only reason not to do a rectal exam is so he doesn't have a rectum. So that's the way we were trained, and we don't really think, well, why? So my colleagues are doing prostate cancer surgery on people there's no prostate, still examining them, like, well, why? So to me, I have to understand technology, have a way to start, clinical trials are nice, but at least saying if this makes sense, let's do things, let's track the data to see if what we're doing is actually having an impact. And I know for sure that, if any man here, how many guys want a rectal exam? Nobody, right? How many guys would say, instead of getting a rectal exam, you're gonna go there, get a cup of coffee, go next door, get an MRI, and you go home? Not so bad. Or watch the football game and throw an MRI machine over here. So, we have technology that we can get an MRI next door if we wanted to, and then that'll give you much more information than any prostate exam. There's studies in Great Britain that the MRI is even better than the PSA that we did today. So if you understand these things and you're willing to ask the why, I as I've gotten to 51, I'll do onto you as I'm doing onto myself. I'm on to Dalafil, I'm on to Tamsulosin, I'm going to get a Urolift. So if I'm not going to do it to you, I want to do it to myself. So as I became a patient and have this background and knowledge, I don't want to wait 15 years to get something that I could have today, but nobody wants to do because the insurance won't cover it. So and the medication, I always said, what do we need to do to get cheap medications? When sildenafil was generic, that's what I gave everybody. I tell people now sildenafil is the way to go. So it's not only about telling you what I think is right, what you can actually afford and what you can actually do. Otherwise, I'm not really helping you. So it's really thinking differently than as I'm a patient now. What do I want? And I'll give you the same thing. So.
And I think where we are right now is a good step too. You talk, what are we doing to normalize or feel more comfortable? Well, here we are now, self-deprecating and thinking we're tough on ourselves and wondering, maybe I'm the only one with this problem, but now it's over 100 guys that we're talking about ED and rectal exams, and we're all talking about how much of us have that. So I think it's the first step to have events like this to kind of realize that we're not the only ones and that we need to go to the doctor and address whatever issues we have.
I'm glad that you weren't avoiding the dentist to ask him a question like avoiding going to the dentist. But I'll say, ultimately, probably fear is the biggest reason why many do not go to the dentist. And I will tell you that it's fear of the unknown. While you will not object to getting an injection in your arm, many of you will be objecting to get it in your mouth. However, the end result outweighs whatever fear that you may have. In addition, when going to the dentist, we are screening for those areas that you may not know. Truly, you're going to come in and have your blood pressure taken, and it is not unusual that we will stop someone and not be able to do the work because of where their blood pressure is. It's not unusual at all that the blood pressure is so high that our regulations say we have to walk that patient down to the emergency room. We cannot treat them at all. Yes, there's in between where we say go to your doc that you have high blood pressure. But that's screening. That going to the dentist twice a year can prevent many things that you can avoid. And it is the dentist that finds many of those things. And once you get into the routine of, again, preventative dental care, in the end, it's like you are friends with the hygienist and really not friends with the doctor anymore. And that hygienist, you're just going, having your teeth cleaned, and you're going home and looking forward to the next 6 months. That is what your goal should be.
So my perspective that, just going back to Dr. Savatta question, that's why I started doing rectal exam. That's why more patients coming. It's just a joke. So the important aspect of, as I concur with him regarding dental perspective, to come into the doctor, also empower yourself, ask questions. This is where not what I make a joke that I am not a scope Nazi, but every doctor is not saying. So you need to ask questions that what is the alternative way of doing things? For example, if you're having gastroesophageal reflux disease or heartburn, doesn't mean that you need scope immediately. So if somebody say that doctor is saying that you need endoscopy, you should immediately ask, what was the rationale behind it? What the risk and benefit? And then a vast majority of reflux disease does not need endoscopy. Only we do endoscopy somewhere that need warning sign. You having difficulty swallowing. If you have long-standing reflux and you have above 60, you have a little bit anemia. I wonder if you have any concern for upper gastrointestinal tract, particularly esophagus or cancer, those scenarios. But 90% of patients don't need it. For example, colon cancer screening, we have is just because you're coming to gastroenterology, I have to pull out my scope, show me a rear end, I'll do colonoscopy. We have other alternative way of discussions for that. Colon cancer screening can be done stool-based testing, not regular blood test that we regular stool test we. This is called colonar. We should be discussing alternative way of doing things. So there is an alternative way. However, very important to understand which patients will qualify for each different procedures. So there is an option. So I'm going to tell he does a lot of preventive care. He discussed a lot of things about it.
And I think the first step is just making it to your general medical doctor, and I think discussing all of the different alternatives and options that you may have. So don't feel that, what you hear in terms of like, oh, I'm going to get a scope, I think the perfect example is we've come a long way, with technology and the way that we test for things, that's what we're here for, to be able to educate you, and then you can make your decision, as to which, alternative, you're going to pick from those.
Next question here, sir.
Thank you, George. First, I want to say thank you to Mr. Terry. The Newark NAACP extends its thank you for this because it is very important. We also want to thank the moderator. I'm a Giant fan, so don't look at me cross-eyed.
For you.
The brothers from the Newark NAACP wants to know, is there a playbook, so to speak, regarding trying to actually enhance and sustain better health? So we heard from everybody, and everybody here is different. Tall, short, dark, long, whatever. But we want to know, well, I should say, they want to know, what is the game plan? Because we have children. So we want them to follow in the footsteps of good health as well. So what would you recommend for a game plan? Hypothetically, you turn 30, or hypothetically you turn 40, or hypothetically you turn 50. What you should be looking at, because everybody here is different. Don't all ice down once.
I think it's a little loaded question, because we can go into specifics, but in my opinion, I try to individualize, all the plan of care, with each patient. So like you said, all the gentlemen on this table, I'm not going to make the same recommendation in terms of how much exercise, even though we have created, these recommendations, you should be working out, physical activity 150 minutes per week, you should be having that plate method that I described, but I think each of you will have a little bit of tweaking around, and that will take too much time to go into more specifics, but I think it goes back to just discussing it with your physician, because some of you may have some limitations with physical activity, depending on the medical conditions that you may have. So I think it's very important to just talk to your physician, and create that game plan, as an individual, as opposed to following someone else's game plan. So,
I can speak to prostate cancer screening. So roughly, the guidelines from the American Urologic Association are if you're between the ages of about 45 to 55, if you haven't been screened already, you should probably get screened. This is something you should talk to your physician about, whether or not screening is appropriate for you. Everybody is different, obviously. People are exposed to certain risks that might be different from the person sitting next to you, but if you have any family history of any cancers, honestly, that puts you at higher risk of being someone who might have cancer as well. But roughly 45 to 55, by then you should have at least gotten one screening done. Screening doesn't always mean the a rectal exam. Like Dr. Savata said, there's a lot of other tests now we can do besides blood tests, urine test, imaging. So in terms of prostate cancer screening, I would say if you're 45 to 55, see somebody out to start something like that.
Question over here.
Yes. Could somebody speak to me about post-kidney transplant and the medicine that's required after that and the side effects of that medicine? Because I've been told that by people that have had transplant that the medicine, it lowers your immune system so low that you possibly catch other diseases. A friend of mine's mother caught cancer as a result of her immune system being so low. I also want to ask somebody, I don't know if anybody here is about urology, but could you talk to me about CIDP, chronic inflammatory debilitating polyneuropathy, and how that affects the nervous system, and why it does, because that means it's your body your nervous system is attacking your body to some extent. So somebody talk to me about that.
I don't know if we want to speak about transplant and kidney and that specific. The bottom line is that if you have any transplant, because you don't want to fight the organ, you have to be on medicines that purposely suppress the body's ability to fight that organ plus other problems, and that's true. And I think the bigger question, I would say is here is, my dad, as he got older, had some kidney problems, so a lot of guys probably here probably have kidney problems, and they don't even realize it or know it. When I was 20 years ago, we used to say, oh, your kidney's a little bit off, it's okay. But now we know that if you get ahead of the problem, we're not a nephrologist, if you get ahead of the problem, you need a little less protein, you take care of yourself, you'll never need a kidney transplant. So when it comes to these things, you really want to, focus should be here. If you have one, and God bless the man with the heart transplant, that's a whole other very simple, but all of us here, less of us will need kidney transplants and dialysis. That's a whole different life if we know, get early prevention, and the thing is, so it's really fear of the unknown. I go to the dentist, I had a whole, oral surgery without, just local anesthesia. Didn't even hurt, so the things that we're used to when we were kids, they don't exist anymore. So get educated. The playbook to me is, what do I want to do with myself as I'm 51? So, I personally, I don't really trust the 8-way guidelines. I like the NCCN guidelines, say 40 to 45 get screened. So the guidelines are just those, and they're also made by people. So to me, at age 40, I want to get an MRI, or recommend getting an MRI, because not only got my prostate cancer, I got hernias, and rectal cancer on there. I can get prostate size, I can predict problems urinating, which I want to just take 30 seconds. As we all get older, everybody here is going to start going to the bathroom at night. Everybody's going to go more frequently. The urge to go may leak a little bit, except who? The guys who had prostate cancer surgery. Why? Because they have no prostate. So it's not an aging problem, it's a prostate problem, and that's very, very treatable and preventable if we know that. If we don't know, though, what's easy to fix, what's not, how do you fix it? And me fixing an easy problem early on is much better than trying to deal with a kidney transplant patient later if I have to. So I don't mean to just, and I don't have the expertise to answer the other questions either. But I think that, the main focus here is on know what we are, where we're going. Don't be scared to ask, and it's a relationship. You may not want that scope. You may not want this. Why do you want to do that? What if I want something else? I've had guys that I recommend a biopsy for years. Then they finally get cancer. We treat them. So it's got to be a relationship between the doctor and patient.
that you build a trust and you build a rapport where you're comfortable meeting somewhere in the middle. I'm going to push you a little bit, but it's your body. I can only advise you, and that's really where this is about. Get educated, get a doctor you trust, get to a network you trust, and somebody maybe can help that.
The point I'm making is that for individuals that's on dialysis, the doctor will tell they tell you that to get a kidney transplant, but there's a certain amount of fear with a kidney transplant, and that's what I'm saying. There's a medicine that's being recommended after a kidney transplant, and some of the side effects is causing other diseases.
So
that's what I'm talking about.
So I can speak just a little bit to that. So just as far as transplant is concerned, you're right. Anytime you put an organ from a different person inside of your body's going to recognize it as not part of itself. And so therefore the immune system is going to attack it pretty much for the rest of your life. So you do have to be on medication that is going to suppress your immune system. And now there's a little bit more art than science as far as exactly how much medicine you should be on to suppress your immune system so that it does not attack the new organ, but while at the same time not being on too much medication so that it makes you very, very highly susceptible to having infections or developing cancers or other things down the line. Those are all risk factors going forward that you can develop if you do have to undergo a transplant. However, ultimately we're looking at, we want to know, do the benefits outweigh the risk? And so if you do, get a kidney transplant, you're off dialysis, you don't have a catheter or all these other lines in you, and the risk of, developing blood clots and all these other things are decreased. Whereas you balance that out with having risk of having some of the other side effects from the medications. And so overall, it's a decision that you would have to sit down and make with your physician, and you guys would have to decide what is best for you and how you would like to proceed.
Before we go to our next question, which is right over here, I'd just like to add that the staff is going to be here after we conclude, so it doesn't mean that once the questions are concluded that they're going to leave. So if you guys have some questions that you'd like to do individually as we conclude the program, the staff will still be available. Yes.
Thank you, Mr. Terry and Newark Beth team and Mr. Martin. You guys do a wonderful job with this event every year. So my question is really this. The supplement industry is always in our face. It's vast, it's $1 billion. Do you actually recommend over-the-counter supplements and vitamins? And if you do, are there particular brands that are much more effective than that you would recommend, or should we stay away from it altogether?
I'll speak to urology-specific supplements. So the issue with a lot of the supplements is that they're not under the same strict, like FDA-regulated regulations that medications are. So a lot of the different brands, what they say is in it might not be exactly what it is, and how they make it might not be the same, how they handle it. So there's so much variation across brands and different supplements that it's hard to get good studies that can prove that one works over another. I will say that there are certain supplements in the urology field that, I think the best that I can say is that they probably won't hurt you, but they may not help you. So, in terms of, off the top of my head, I would say, sometimes for preventing infections, a lot of people will take cranberry supplements or something called D-mannose. Now, there's not a lot of great data that says that these things can help, actually, but there's also not a lot of data that says that it'll harm you, so it's sort of one of those things where, maybe it'll help, and if it helps, that's great, but I wouldn't put a lot of stock and expect that a supplement that's poorly regulated and not having a lot of consistent good data will actually be helpful. The one big thing in terms of treating enlarged prostate is saw palmetto, and there's probably tons of different forms of it. There's a lot of different brand names of formulations that have saw palmetto and other herbs and things like that. So, there's maybe some data that supports that it can help improve your urinary function if you have an enlarged prostate and you take saw palmetto, but at the end of the day, it, again, may not help you, but it probably won't hurt you.
I mean, I think the only thing that I have to add to that, if you are taking some of these supplements, make sure you discuss it with your physician, because, I mean, for those of you that have chronic medical conditions, if you're taking medications for those specific conditions, these medications can interact, and it can affect the levels of those medications and cause more harm to you. So I'm in that same side in terms of, whether we recommend these type of supplements. Most of the times, your physician will be checking certain things in your blood work, things like vitamin D, B12, iron. So, and that's kind of like the gist of some of these supplements, at least for the vitamins that the gentleman was asking. So, in my opinion, I don't think a general vitamin like Centrum, and I'm not just throwing that specific one because there's so many different ones. But discuss it with your physician. If you have some concerns, we can check those levels. And if you need extra supplementation, we can provide you with more specifics. So.
I think what we're also guilty of is trying to find that next best thing, that best pill, and skip the doctor. But let's have that conversation. There's so much to do before we even have to go to the shelf. There's studies saying that a Mediterranean diet where you just focus on more seafood is better than any antidepressant. So there's a conversation you have with your doctor on how to skip even having to buy these pills, rather than even spending your money and maybe doing more harm to yourself. There's studies on other things out there like lavender for depression, but I mean, who's going to take that and dip it in their tea? I mean, let's be realistic. Have that conversation with your doctor and baby steps before you worry about supplements or pills, when we could start at home with better meals, just like that.
We haven't concluded this yet. We have one final question from the gentleman over at number 15.
I have a question for Dr. Patrick. A lot of my friends and people I know have a hard time finding therapists, counselors, because they don't have medical insurance and things of that nature. It's really difficult to find. And those who do have it, they're limited to a certain amount of sessions. Do you have an alternative for people in regards of mental health? Do you have any type of step, or any other doctors? Do you have any kind of alternative measures for people who struggle with either depression or anxiety, if they can't get to a therapist, if the therapist is booked up, if they don't have the insurance, if they're struggling? Do you have any tips or steps that a person can do outside of the medical field?
Well, let me validate that what you're saying is completely true. I have friends coming up to me saying like, hey, I got this friend, you know someone in the area that is taking insurance or taking patients, and I can't even get them help because it just doesn't exist. And we live in New Jersey, one of the most dense places in the country, and it's tough. And the easy answer would be, the alternative would be, maybe seek an app or seek the internet, but even I don't really recommend that unless you're more well-adjusted. When you really want to start, you want to have that contact, you want to talk to that doctor and see what direction to go in, because you could be dismissive and just kind of play along with the motions, through telehealth. It's not the best response for you, that maybe what you're looking for, but maybe it's tough out there, but there are clinics to at least get your foot into the door that take your insurance. Newark, Beth Israel for one, and Hackensack. They have these clinics, they have openings. It's just that maybe it's hard to realize that we grew up thinking, okay, we need to find this doctor who has this office. But no, you could walk into that clinic and they'll take you. And if it's a good fit, then great. And if that person and that doctor thinks to find an alternative, there you go. That's where you can start and find that alternative, rather than finding the alternative before going to the outpatient clinic at Newark Beth Israel.
I mean, I think being open to your physician as well, because I know there's such a stigma, when it comes to mental health, especially from the men's perspective, I mean, there's a lot of times that, some of my patients present with other symptoms, when in reality, what's been affecting them, it's the anxiety, the depression, A lot of physicians, including myself, we feel comfortable, at least starting, some type of management, And I think as my colleague said, there's also alternatives, to do telemedicine, so you can do televideo type of therapy, And those are some of the things at Newark Beth, we actually have a behavioral health program, where we can actually incorporate you into that as well. So speak to your physician and be open about it, And I think that's where the first step starts, because then they can guide you and assist you, with the next step. So.
First step's always the toughest, but if you ask, you'd be surprised what doors open after that. I'm guilty of it too.
Gentlemen, that concludes our formal presentation. So please give a round of applause. Now, before we leave, please maintain your seats because Mr. Tia has some announcements that she'd like to make.
So if you didn't notice, I just told them to lock the doors, don't let anybody out. What a fabulous panel discussion today. We have another round of applause for our team. Again, we want to acknowledge the person, the visionary that makes this happen every year, that makes sure that we are in this space gathering with the right information, the right people here. Our president and CEO, Mr. Darrell K. Perry. I got a lot of credit for today, but I want you to know that this does not happen without a team. And so everyone else out there, you see with the jersey on, all of the people who are assisting you on the outside, those are the people who make today happen as well. And Lisa Krapps is one of our point persons. You guys have spoken to her. I want to make sure that all of you know that we are still having the screenings next door. The screenings next door are continuing throughout the night, so we want to make sure that you have had the opportunity to participate in the screenings, and that when you turn in your registration card and get 4 dots, that's 2, so that's not complete. 4 dots on the back of your card, you then qualify for that 65-inch TV that we are going to raffle off at halftime. You must be present to win. Ooh. Yeah, hang in there for halftime. And we do have quite a few auction items that I did not see anyone bid on as yet. So if you are looking to bid on those items, I'm going to ask that you take a look in the hallway and bid on those items. If not, I will pull them back and we'll have them for our next event because they are worth just that much, right? The other part of this is that I want to acknowledge the different organizations that are in the room today. I know we had some contact with Kappa Alpha Psi, Fraternity Incorporated, Psi Phi, and we have any Sigmas.
Blue flag, you know.
We got Kappa. Y'all know I'm up here trying to figure things out while I'm doing this. Iotas. Who am I missing in the room today? Alphas, of course. I have to pick with my councilman all the time to make them think that I'm going to forget he's in the room, but here we are. And NAACP, and are there any other organizations that brought out people today that made this a successful event? NAACP?
No.
K Movement? King Movement, I'm sorry. Anyone else?
Men's Wellness Group.
The Men's Wellness Group. It's because of you showing up each and every time about concern about yourself and your brother next to you. I am my brother's keeper, that we're able to fill this room and get information out to people. And one other thing that we have is that we have community partners. And so Newark Beth Israel does not do this work alone. We have community partners, and so it's because of those community partners as well that we're able to do things here. And that is it. I invite you all to finish your screenings and join us downstairs.
Thank you.